Assalamu alaikum and a very good morning to you all. I hope you guys are doing very well today and you're ready to start your day with Shahzad Khan and Maha Mukhtoom on World This Morning. Assalamu alaikum Shahzad, how are you?
Walaikum assalam, I'm absolutely perfect and at the same time getting nostalgic about the days we have spent on Eid.
I was just about to ask you how, because I was like, he's not going to pause for me to ask him how was his Eid. So I'm going to have to wait for a little break. But anyway, how was your Eid? How's everything?
My Eid was superb. Obviously, we get to spend time with all our amazing viewers who are out there. So for all those 3 days, we were here in the studios, and likewise, we are here today as well, ladies and gentlemen.
Yes.
But other than that, I think my Eid was fabulous. It was superb. So I got to sit with all my, nephews, nieces, and everybody else as well, and then the Buzurg of the family, and it was great to spend time with them. And then, yeah, I collected a bit of Eid as well.
Oh,
What about
actually
you?
got some. And for all those, Buzurg in Urdu means elders for all our non-Urdu speaking people. My Eid was very interesting. I kind of did not spend it with family. I did my own thing because my family are in England. So I decided to have some meditation time and Maha time. So I just went, had a break, refreshed myself, re-energized, and now I'm here.
Sorry to bring it up, but I heard that you were boxing somewhere.
No, yeah, well, we'll talk about that some other time. But I was at some retreat which was about mental and physical health.
Amazing that is, ladies and gentlemen, and that's what in line is our topic as well. But then at the same time, we do have a public service message. We do not want to start our show with the top stories as well.
No.
Because the top stories, you might have heard them. We do not want to repeat them right now because the issue we are discussing or picking up on, I think, needs massive attention.
Absolutely. So let's have a look at our public service message for today.
All right, ladies and gentlemen, time now for public service message. And to do the honors, I think it's going to be Maha as well. So Maha, take the spotlight.
Okay, so today, in line with our show, we would like to highlight the importance of being very aware of your psychological and mental health. I think that's, and we're sitting by professionals, right? So when we're sitting by experts, I get really insecure with the words that I use.
Exactly.
Because when you're not around them, you just throw these words around like you're really clever.
That's,
but anyway.
that's why, when we were about to start the show, so I actually referred to them and I was like, can you actually tell us a few symptoms about mental health as well, or where you think that the mental health is deteriorating? So, but I couldn't really figure it out.
No. So basically, no, we're going to do a general public service message, which is, care about yourself. If you're feeling low, if someone's around you not feeling good, there's no problem in going to someone who is an expert in it, like a psychiatrist, a psychologist, or a therapist of some sort. But you do your research, but there's nothing wrong with that, and we need to get rid of the stigma. We're in 2017, it's about time that we look after ourselves.
Exactly, and there's no harm in it. And for all those parents who are out there, because of the fact that, we have actually been discussing quite a lot of different shows as well, where we have been talking about child abuse as well, we've been talking about child labor, we've been talking about other issues which kids can actually face in their schooling days as well, just because of the fact that the relationships are deteriorating. Because I'm saying it because of the fact that we do have these gadgets, then we do have tablets and whatnot, where parents really do not spend their time with the kids. So the kid cannot actually talk. So what we call catharsis, obviously kids do not even have an idea about that. But if you realize that your kid might need attention, obviously the kid himself or herself is not going to go to a psychiatrist. It'll be you, and there's no harm in it.
Exactly. So so that's our public service message, and now that will lead on to our show today, and that is exactly what we're going to be discussing. We're discussing the state of mental health in Pakistan. What are the services like? What are the resources like? What is the society like these days? And we are going to be highlighting on what is happening to the children, and especially with the child sexual abuse that's going on outside.
And then at the same time, Maha, since Ramadan was a very different month for us this year as well and last year as well, because Dr. Yusuf Raza used to join us. So the first segment, we didn't do much of talking. So we need to get into the flow as well. So for all those mistakes which we are going to make in the initial days, we're very sorry for that.
Yeah, so it's about patience. So to discuss this very important topic of mental health and the situation in Pakistan, we have been joined by Dr. Aisha Minhas. She is the Assistant Professor of Psychiatry at Rawalpindi Medical College. She's also the Head of Child Psychiatry Unit at the Institute of Psychiatry at Benazir Bhutto Hospital. Assalamu alaikum, good morning. Thank you so much for joining us today.
Thank you for inviting me.
Besides Dr. Aisha Minhas, we've been joined by Professor Farheed Minhas. He is the Dean of Psychiatry of the College of Physicians and Surgeons in Pakistan. He's a former head of the Institute of Psychiatry at Benazir Bhutto Hospital and a professor there at the Rawalpindi Medical College. He's also the director of WHO Collaborating Center Is that correct? That's correct. I've got a bit of a typo there, but
Yeah.
Assalamu alaikum, good morning.
Good morning to you.
And to start our conversation, there's one more thing which I can be sorry for, but I just wanted to ask because I was being inquisitive of the fact. So we do have Dr. Aisha Minhas with us, and then we do have
Professor Fareed.
Professor Fareed Minhas with us as well. Are you guys related? Just because of the last names you guys have. I'm sorry, I did ask that
No,
before,
you should-
because I wanted to ask this on air.
Yes, I think it's very obvious.
They're married, of course.
But the last name says Minhas, so I was like,
Yes,
maybe.
no, they are the it couple in
Yeah.
regards to the.
Mashallah.
Well, we dated for some time, and then we decided to get married.
Wow.
Great, thank you so much for joining us today,
Thank
and
you.
in such an important topic. So we're just going to get straight into the conversation, and I will start with you, Professor Fareed. Mental health and psychiatry in Pakistan. What is the situation right now in 2017?
I think the situation is alarming, if I say that. And I say alarming because of the fact that significant proportion of these disorders exist. They are not recognized, they are not treated, and because of that, the damage that is being caused on the family, on the society, and on the individual is tremendous, and that is why I call it alarming.
Okay, right. So now going forward, you've been in this profession for over 30 years. It's still alarming. Have we improved at all since you started, or are we headed in the right direction? What is the situation specifically right now?
Well, I think we are heading for a disaster.
Oh wow, okay.
The way things have changed in the last 30 years is simply that we have started to define and we have started to identify and recognize that these disorders exist. But we have done small works of small islands of good work that people have done all over the country. But it has not been consolidated into a kind of a national movement
Okay.
that we need to recognize, and then we need to know what our priorities are and know what the solutions are. We are working on ad hoc basis all along this time. Recognizing and saying that this disorder exists does not get us away from the responsibility of doing something about it.
Okay.
Okay, so I think, if we talk about doing something about the issue, I think we need to cater to the perception, how people perceive about mental illnesses over here in Pakistan as well. And since you have been affiliated to World Health Organization yourself, what are the facts and figures? What do people think about mental health, or probably going to a psychiatrist or a psychologist, because we think that it's tabooed and still stigmatized?
I think you're very, very much on the right track, that to consider yourself having a psychiatric problem is a big stigma in our country. And if the stigma exists, people who have this disorder do not cross the barrier of going and seeking help for that. Instead, the health belief models that we have in our society, that it is a possession, it is a jinn, it is a jadoo, it is a spirit that is taking you away, takes our patients away from the treatment that is so important to be given.
Yeah.
Okay.
And WHO has very rightly figured out with some studies that depression at this point is the second or is the fifth important cause of disability that it causes, and by year 2020 it is going to become the second important cause in terms of the disability it causes. And in our society, symptoms of depression are not the psychological symptoms that people talk about.
Okay.
And that is the reason is that society does not permit the expression of distress in our population.
Okay, so this is where I was going to lead to next. With you were going with this. The type of problems within Pakistan. How prevalent are psychological or mental health issues in Pakistan? Because you said we don't tend to express it, but that means people will say that over here we should be happy, everything should be fine. But how prevalent are they?
I think they're very prevalent. If you look at the common psychiatric disorders, and if I call depression as one of the common disorders, about 30% of our population suffers from this disorder.
Okay.
Women tend to suffer twice as more as men would.
Right.
And women tend to suffer more during the childbearing ages. And just imagine the impact if a woman who has given birth to a child is depressed. what happens to the growth of that child intellectually, physically, and cognitively, that absolutely gets damaged and destroyed. And the impact in the mother and the child relationship it becomes even more significant when attachment and bonding becomes affected because of this illness.
Okay.
And because of the attachment and bonding, the personality development takes a very different tangent, which the families have never dreamt of. They were with all the facets to bringing up a good child, but because the depression existed, they went into wrong direction.
I think for that we probably need to move on to Dr. Saiba over here. So Dr. Saiba, let's talk about these dimensions where the intellectual and the physical upbringing of the child might be disturbed as well. How does it impact, and then why does it get unnoticed as well? We get away with it.
Yeah, so, the first 5 years of life are perhaps, I would say, the most important in our lives, because that's when the brain is developing and the child's personality is forming, and he's learning how to control his emotions and how to cope with stress.
Right.
And that's the time when anything goes wrong, our brain's anatomy is affected, the physiology is affected. So because of this, the damage is pretty long lasting.
Okay.
And the child is unable to develop his full potential, not only in psychological terms, but also the research shows that the cognitive abilities are affected, his social functioning is affected, his emotions and patterns of reactions are affected. So anything going wrong during childhood and adolescence causes distress at that time, but more importantly, it stays with you forever,
Okay.
All right.
Yeah.
Okay, so now, so that's one aspect. So you have depression, which is one of the prevalent, disorders. Is it a disorder, depression? It's a disorder that's affecting 30% of the population, and women tend to suffer 2 times more. What are the other, because in a country where you don't really, like you said, it's either a gin or there's something, other excuses or reasons are made, what are the other prevalent issues, psychological issues or mental health issues we face here?
I think the other are the severe mental illnesses that we call as schizophrenia, substance abuse,
Okay.
dementia, that's a disease of the old age,
Right.
some of the sexual disorders, depression I have already mentioned, and along with depression is suicide, a very high incidence of suicide in our population that goes fairly unnoticed.
Okay.
Okay, there's one more thing which I think is very important. We need to highlight that issue, and that too is that over here in Pakistan, we have witnessed that majority of the times that all of these jinn issues or jadoo issues are more prevalent with the women's, or probably I think with that segment of the society. Okay, let's just rephrase it. Why do you think it's that way? Is it because that the depression or the disorder prevails within women in numbers? Do you think it is more, or with men it is less, or with men it does not get noticed, or people find an escape, or with women? How do we figure it out that which segment is suffering the most?
I think when there is a basic conflict in a society, men tend to take a different view of expressing that distress, and women tend to take a different view. And it depends on what the input at that particular point in time that men would resolve conflict with aggression. They would take on substance abuse, alcohol, or any other related activity like that. And women tend to take everything in, and then if they cannot express their psychological distress, they would convert it into physical distress and complain of bodily symptoms, body aches and pains, not able to concentrate, not able to do their work, and just feeling unwell.
Okay.
So it depends on the doctors to understand very basic history-taking techniques, that if you are complaining about a physical symptoms for which no physical cause is found, then it has got to be something to do with the psychology. And in a society where the doctors, where the community feels this as a stigmatized speciality, the patient continues to suffer unnecessarily for a longer period of time.
Okay, interesting.
I think that is very interesting, and for all those people who are out there, I mean, if you do complain about different aches and pains and there are no physical symptoms for that, I think you probably need some attention. And for
Yeah.
those people who know such type of people, please try to counsel them as well.
Exactly. Okay, so now that's talking about the different issues out there, but I'd like to move on to the specific areas as well that you're working upon. So, Dr. Aisha, you've started a project, and it's about focusing on the issues of child sexual abuse and the psychological impact of it.
Yes.
I have a lot of questions on this. So, first of all, let's start with the basics. What is defined in Pakistan as child sexual abuse?
Yeah. So, child sexual abuse is defined as any activity in which an adult or an older child uses a younger child in any sexual way.
Right.
And it includes touching and non-touching activities.
Right, okay.
Yeah.
Touching and non-touching.
Okay,
Yeah.
and
Okay, touching I can understand, but non-touching I cannot.
Yeah, in touching, I think fondling is the most common. In non-touching, an older person might expose his genitals or make the child do that. There can be child pornography. So, or talking about, sexual themes.
okay, so now this is so that very just obviously for our viewers, it's very disturbing and thing to listen to in the morning.
Yeah.
But we have to talk about it because it is going on there. How prevalent is it within
Yeah.
our society, within a global society?
Yeah, it happens all across the world.
Yes.
So it cuts across race, religion, and social class. And I think exact figures will be impossible to find out because there's so much shame and stigma associated with it that most of the children will not go up and report this.
Right.
So most of this goes unreported. However, the figures from the National Institute of Mental Health in USA show us that 1 in 5 girls and 1 in 20 boys are abused.
Oh wow, those are huge figures.
Right,
That's a
so-
huge figure.
So that means that we actually have to initiate from where we make our parents aware of this menace as well. What do you think the parents need to know about this menace? Or for example, if their kid, God forbid, is going through such a difficult phase in his life or her life, how do you think the parents will get to know? Because nobody ever speaks of it. And I have seen people who have been, suffering through this disorder, depression first of all, or personality disorders because of the fact that this is something which happened to them at a very young age, but they do not let it out even if they sit down with a psychiatrist or a psychologist or with
It's a
somebody
lot of
else.
shame.
Definitely. So that's why the campaign that we started, we named it Unkahi, because it's, mostly it's unsaid. And it just lives with you, and the child carries this secret burden for the rest of their lives and finds it extremely difficult to talk about it. And I think the biggest enigma surrounding this is the conspiracy of silence that goes with it.
Right.
We as adults find it very difficult to talk. We hardly ever talk to our children about normal sexual behaviors or unhealthy sexual behaviors or what is abuse. And you can't solve a problem if you don't recognize it, if you don't talk about it.
Right.
So we all know in some deep recess of our mind that it's there, but it's, it never comes up on our lips. We just remain silent about
So
it.
what do the parents need to know about it?
So I think that's what our campaign, Unkahi, is all about. It's to raise awareness. And so by different means and methods, we are trying to spread the message across to all parents, teachers, and other professionals who work closely with children. And try and empower them with a tool set of how they can prevent this, how they can identify early signs of it, and how they can stop it. And if it's happened, unfortunately, then how do they manage it?
So let's start talking about it. First of all, let's talk about, do you think that we have got, professors, have adequate resources to probably make people aware of the fact that this menace is going around in our society?
I think this is a job too important to be left to mental health professionals alone. This is a public health issue. Families need to be educated. Families need to be informed about this. And I think every doctor or every health professional needs to be aware of these things. Because a mother taking her child to the pediatrician, pediatrician can pick that up very quickly.
Okay.
School teachers can look at the behavioral signs of this condition and they can pick it up very quickly.
Right.
Neighbors can pick it up, and last and most importantly, the parents can pick it up. And I think it is very important, every parent-to-be needs to know a 10-minute talk about what this is all about, so that they see the responsibility delivered in the true sense of the word.
Okay, and you know, it's so true, you know, and it's out there, but realistically, on ground level, I mean, just from the little, I don't have that much exposure, but the little interaction that I have with people is that even with adults, even with people, you know, who I work, like not work with or I hang out with, if they're from Pakistan, you could make them aware of it, but if they were going through that, or they've been through it, or someone they know, it's still, oh no, but we're not going to say it's us. There's still that level of shame, there's still that level of denial. How do you educate them? Because it's easy to do.
Or encourage them, yeah.
Encourage them, because you have the campaign, but you know, we become empowered just by our words, but not by our actions. Do you agree with that?
Yeah, I think it's an uphill task, to say the least. And you need to change the knowledge and the attitudes about this. And, you know, the awareness is appallingly low right now.
Okay.
So I think it's basically an awareness campaign, and we are doing it under the umbrella of a parenting program, because that would be more acceptable. So, you know, empowering the parents of how to parent in the most optimal ways to raise a healthy child who's not only physically healthy but psychologically healthy is the umbrella project. And one of the chapters is Ankahi, and that targets trauma or abuse of all sorts, which according to WHO is of 5 kinds. So a child can be subjected to physical abuse, emotional abuse, sexual abuse, he can be neglected, or there can be commercial exploitation.
Okay, we'll definitely talk about that, but at this very moment, ladies and gentlemen, we do have to go for a short break. But when you guys are going to come back, there's one more thing which I want to ask, and that is that, you know, all of those experts, all of those people who are out there to help, they have different opinions. And for example, if you change your geographical locations, the doctors somewhere abroad might say that, you know, it's the individual's choice whether he or she wants to get the treatment or not. Things are different over here in Pakistan as well. So what do? Do we have a mixture of it? Do we go by what people say over there? Do we go by what the experts have to say over here in Pakistan?
Exactly. And another thing that we're going to be discussing is a continuation of this abuse, but also the other traumas that are prevalent within the society and how it's impacting us as a community as well. So with that, stay tuned and we'll be right back.
All right, ladies and gentlemen, we are still in conversation with Professor Minhas as well and Dr. Aisha Minhas, and we are talking about child abuse and then what other dimensions can we probably look into to get rid of this menace. I think
Exactly.
that's what it is. And for all those people who just got tuned in, well, I just gave away the gist.
Exactly. So before the break, we're talking about child sexual abuse, and just very briefly, we touched upon it. So you've mentioned 1 in 5 girls, 1 in 20 boys, but what are, like, let's get into more details about it. So how prevalent is it? Is it in every home? Is it in, you know?
Yeah, so I think there's a very prevalent myth that it's committed by strangers, and we often do inform our children that don't take, accept any sweets from don't go away with a stranger. But unfortunately, this is not true, because 3 out of 4 adolescents, again, this is figures from US, knew the perpetrator very well. So that was somebody very well known to them.
Okay.
And unfortunately, incest, which is child sexual abuse within the family or within the blood relatives, is very common as well, and it's the most damaging. So 1/3 of all abuse cases happen within the family.
Oh, wow.
And I think I would love to raise awareness regarding that as well. Now, since when we were children, I think that's how people get the idea as well, because when you keep on discussing such issues and you talk to people, that's where you get to know. So we have had games with the names of Dark Room, I don't know, Ghar Ghar, and all of these things. I think we need to look into depth, how kids were playing, were we vigilant enough while they were playing as well, because they do not have any idea of what they are doing. But we as adults probably need to be more vigilant about all of these issues. Do you think that it is correct?
Definitely. And that's what our campaign is going to be aiming at as well, to educate our parents about what are normal and healthy sexual behaviors. Because as a child is developing, so his sexual development also starts very early on, from perhaps infancy. And you just don't suddenly transform into a sexual being at the time of puberty. So it's an ongoing learning process. And so what are the healthy sexual behaviors that parents need to know and that parents need to talk about, and also what safety information they need to impart to children.
Go ahead.
So that's something we are not doing at all.
Okay.
So, and sometimes we are fearful that if we talk to a young child about what abuse is, we might be introducing horrible ideas
You're
into
corrupting
the mind.
them, yeah.
But that's, I think that's absolutely a myth, because I think now it's high time that we forget the shame associated with it. We forget the fact that we are trying to preserve the innocence of the child by not talking to them, because this is all very small as compared to the risk
Okay.
and the effects. And every child is at risk, no
Okay.
matter he is living in a very wealthy or a highly educated or a very religious home, or he belongs to a village in an uneducated. So no child is immune.
So
Exactly,
what are
exactly.
healthy behaviors? Let's talk about that.
So the healthy sexual behaviors are, very gradually the child. So when the child is very young, there is less of inhibitions, and so he may fondle his organs, which may be very normal. So we don't need to, that's important to tell the parents, because you don't need to get alarmed about that. But there is a steady progression of sexual knowledge and development, which is a more detailed. And so we're preparing culturally appropriate information in Urdu, so which we would like to disseminate, so that parents know exactly at what age, because it will depend on the developmental level of the child. What you're going to talk to a 2 or 4 year old is going to be different what you're going to be talking to a child who is approaching puberty, 12, 13 years old.
Exactly.
So according to the developmental level, the degree of complexity of information keeps changing.
Very nice.
Okay, so great. So we did miss. So I wanted to say that now, before we talk about the healthy, what are the other symptoms? So let's talk about, for all the part of the awareness campaign, it's about raising the symptoms or the changes in behavior if you know whether your child is suffering. So what are those things that parents should be looking out for, and what are the consequences of not doing that?
So this is, so to say, the red flags.
Yes.
When your antenna is going up that there's something's going wrong. So if a child is doing any kind of sexual act which you feel is developmentally much ahead of his age, for example, a young child trying to fondle genitals of a much older person or a much older child, you know, engaging in such an activity. That's something you need to think about, that where did he get this information? Was he abused and exposed to this at a very young age? And sometimes the child will show problems in behavior. So the child may become very aggressive, because anger is one of the commonest manifestations in a child who is being abused. The child may become clingy and show regressive behavior. So the milestones that he had already achieved, he begins to lose that. Because, you know, in very young children, they don't have the cognitive development to talk about what's happened to him.
Yeah.
So the trauma in his head is going to be reflected in his behavior.
Okay.
So aggression, clinginess, he may develop some kinds of phobias. There may be eating problems, he may go off food. There may be sleeping problems. He may relive the abuse during his sleep and have nightmares.
Okay.
He may have flashbacks during the day. He may refuse going to school. So school refusal is an immense problem. Academic decline can happen. So there are lots of red flags that parents need to be very aware of and closely supervise.
Okay, now there are two more things which I need to ask, and Professor Saab, I'll move on to you. So now, first of all, do you think our society is ready to, you know, absorb this information? And then, when we sit on a TV channel, you know, and we utilize this platform to make people aware, do you think this is the right dimension we're talking in? Because for somebody who's actually going through or suffering from all of these disorders, do you think they'll be very comfortable with listening to what we're talking about right now? Or do we need another approach?
No, I think the approach has got to be through the media,
Okay.
because media is the mastermind of all the societies and all the communities.
Yeah.
And I think this myth has to be broken absolutely in the beginning, that it is better to talk about these things rather than to hold it back. Otherwise, we are becoming partners in the conspiracy of silence. So education has to come through the media, and very few channels, unfortunately, would give any adequate time towards the dissemination of this kind of information.
Yeah.
If you do an audit of all the media time, you will find other interests are more common than the interests of the society, developmental things, cognitive things, and the values and the ethics that we want to teach our children. And I think if we have a wholesome program where the health, physical, psychological, and mental health is being spoken, that would be the first step to take this campaign or to increase the awareness in the societies.
All right.
Very often, there are two ways to look at it. One is that you are dealing with the trauma that has happened, and the second aspect is that you're trying to prevent the trauma that is going to happen. So for those who have happened, as Aisha mentioned about the red flags, very few people would come and say, we have this problem of sex abuse. Now, that's not the name of the game. The name of the game would be people with the red flags would seek the health professionals for a reason that they can justify. For example, it is easy to say that I can't focus on my studies.
Yeah.
I tend to fight with my brother. I tend to disagree with my dad more than what my other brothers and other siblings do. Now, those are the red flags that if you pick that up, dig deeper psychologically, and then probe that it has happened, you will find that they will be able to connect. And I think I liked your question about this, that people who have undergone sex abuse, it takes the health professional at least 5 to 6 sessions to give that degree of confidence to them so that they can generate that secret and open their heart that they've been carrying for a long period of time. So this is a trauma that is very deeply embedded. It takes certain skills at the hands of the health professionals to open that valve whereby they can start communicating.
So for somebody who really wants to seek attention, or probably want to go to somebody who's an expert as well, but he or she, as of yet, has not been able to do that, how do you think that we can encourage them or motivate them to do it?
I think it's not only the sex abuse, it is the whole ambit of psychological problems that people continue to fight and delay and deny, and a lot of time is lost from the onset until they seek help. Now, that's a very, very crucial time. Studies elsewhere in the world have seen that if you pick up this duration of untreated psychiatric situation, the prognosis becomes better.
Okay.
And if our schools have counselors, if our school teachers are educated about it, if our doctors are educated about it, and they are willing to ask one or two questions which raises the red flag, then that's the way, that's the first point to identify these individuals and dig them more deeper.
Okay, amazing. So now, but Professor Minhas, you've been working in this area for a while. Do you think that's where we're headed? Are we headed towards having counselors in schools? Are we headed towards, you know, not hiding these abuses on children and telling them that, you know, they should be shameful about it? Are we?
I think when I said alarming in the beginning,
Yeah.
if 50 schools out of 10,000 schools have done something good, for me that's no big deal.
Okay.
Our masses are in the villages,
Yeah.
our masses are in public schools, and public schools have very different policy towards all these things than some of the private schools. So I think in terms of the public at large, we are doing absolutely nothing
Yeah.
to give them that knowledge, that information, and we are not preparing them to deal with this cause.
Okay, and because, you know, because we finally got you on the show, we've been trying to get you on the show for a while as well. As a professional, do you what is the worst case scenario if we continue down this line? I mean, just so that people get an impact of
Because
how
we are
important it
continuing
is.
down the line.
Yeah, so how, you know, just so they realize how important it is. What is the worst case scenario?
I think the worst case scenario is that it will continue to happen and the potential of the people that we have in our society would continue to decline.
Okay.
And we would have individuals who are uneasy within themselves, they are uneasy in their relationships, they are performing badly at work, and they're costing the national taxpayer a huge amount of money that is being wasted on them.
Okay.
So if you have a child who has this burden, which can be recognized and which can be treated, he becomes a different individual. He performs, his outcome and his output becomes very different. And if you leave him untapped, he would continue to underperform.
Okay, and then, Dr. Saiba, at the same time, we do see that the Pakistani families, typical Pakistani families, do have the tendency to brush it under the carpet as well. And most of the times, I think it has been done because you very correctly mentioned that it's not the outsider, it's not the stranger, it's people within the family. And then I think that the parents are not left with any other option but just to, you know, brush it under the carpet.
Why
How
is
do
that
you
even an
think-
option?
How do you think we are going to empower them to probably come up and talk about it? Because recently we did have this drama serial on television with the name of Ordari. I think it was highlighted as well. But Ahsan Khan, he even won the award, was actually being criticized for playing that role.
In the
so
beginning
that's
when
the
they
society
started it, yeah.
we live in, right? So how do we do it?
I mean, I'd just like to highlight, so he was criticized when they started making
drama,
it, and the director said, well, I'm making it for people who make these comments. Then when he won the award, the host made a very crude joke about pedophilia, which was completely, you know, not appropriate for a media personality. So, you know, where are we? What's
Yeah,
happening?
babe.
Yeah, so I think we have to start somewhere. We know it's not happening. And so, you know, when we were doing this campaign, I was thinking what we can do. So I think one of the most powerful medium of communication is film. So we've made a short 15 minutes film. That, I mean, it's my desire that it should reach every parent in Pakistan, whether it's the
Or elsewhere in
deserts
the
of
world as
Sindh.
well.
Or, yeah, well, it's in
in
Urdu
Urdu.
right now.
Yeah.
It's in Urdu right now. We're doing English
We
subtitles.
can do that.
Yeah, excellent.
That'll be great.
Yeah.
So, you know, because the literacy rate is also not high. So we were thinking of brochures or you know, that wouldn't have been, that wouldn't have made an impact. So yeah, everybody is watching TV. So if the social media or the television can come to our help and air this video, I think that's, and it gives very comprehensive and a very holistic kind of information of what sex abuse is about. It doesn't talk about prevention, but at least it can make you aware. And like you said that, you know, even if sometimes the parents come to know what's happening and they still fail to talk about it. And that's going to cause a secondary trauma to the child. The primary trauma was the sexual abuse. And if he is able to disclose it, and only 1 in 10 children, or even less than that, will talk about their abuse. So 9 will keep it a secret. And so one that does talk about, if he is not acknowledged, if he is not listened to and the thing is just brushed under the carpet, he is going to develop secondary traumatic effects like further lack of trust. And then he's not going to share his things with somebody else.
Self-esteem, value of
He may be disbelieved, and then he'll develop guilt and shame and self-blame and low self-esteem.
Well, one last thing
Sad.
over here before we wind up as well, and that is that, for example, that we tend to get our hands onto somebody who wants to share it with people and be an example and lead them out of it as well. Now, it all depends on how people are going to respond or react to what he has actually said, just to raise awareness. Don't you think that that can be a secondary trauma for that person once again as well, just because he wanted to be an example and don't want people to be astray because of the fact that he went through all of this as well? So how do we deal with it?
So the person who discloses, you
Yeah.
mean? Yeah, I think that takes immense power and confidence to do that. And it will directly depend upon what the response of the listener is going to be. If you're empathic, you acknowledge, you believe, and you talk about it, or if he's seeing a therapist, then the therapist, discusses in detail and dispels the bad feelings that have arisen from it, like guilt, because many victims begin to feel that it was partly their fault that they let it happen.
Yeah.
Why didn't they stop it? And this guilt can be enormous. So you need to work through all their feelings and try and bring some sense of, I won't say cure, this trauma, the memory of this trauma can never be erased. It lives with you.
Okay.
All you can do is that you have better tools to deal with it.
Amazing.
And just finally, because we have run out of time, but
was
with
very
this,
short.
yeah, it was. It's never long enough when we do a show on psychiatry or psychology. But with this campaign, what would you like to? What are your hopes for this?
Well, my main hope is to raise awareness, and that would mean that my message, especially through the movie that we made, and we'll be making
We're
sequels
going
of
to share it on our page as well.
Oh, that'll be
Yeah.
great. So that's mainly about awareness, and we are going to follow it up with different messages like prevention or how to seek help. So these are little movie clips, and everybody has a mobile now. And so if it can spread on WhatsApp, or if you are kind enough to
We will do that.
air it on the television and give people the link, I think that's just a starting point. And so ultimately we want that it should spread to all the people of Pakistan.
Amazing.
And Professor,
I think it's important to raise awareness, but side by side we have to be prepared that once we have raised awareness and people come to us,
Yeah.
what tools we develop to treat them.
Yeah.
And we are working in our responsibility after reaching raising the awareness to tell these people whom they can contact and how, once they contact, what kind of culturally appropriate psychiatric, psychological interventions can be done. So that's the second part
Amazing.
of the campaign that Aisha is leading, that we're going to provide solutions for that.
wonderful, great,
you very
and best of luck with the campaign. And whatever we can do to
We will
support it, we
definitely
will
do that.
definitely do our part. But it's
And
always a pleasure to have you.
There's
Abhijit.
one
Thank
little
you.
suggestion for all those caregivers who are out there, for all those mental experts who are out there. Difference of opinion is cool. We do accept that as well. But doing that right in front of different number of patients, please don't do that, because then the normal population, the general population, they get confused as well, then whom to consult and where to go. Please make sure that you do not confuse people.
Exactly. And I'd just like to add that, anything that you're going through, communication is key. And, it's about being brave. And sometimes people aren't going to believe you, but you have to power through it. And you have to believe that there are good people out there that want to help you. And we will share any of these links, all of these links on our show, even the link to the video, which is very important. And it's in Urdu. So it's, it'll be really good for all the viewers.
So please make sure that you are the beacon of light. I think that's what it is. We are going to share all the short films on our Facebook fan page, which is with the name of,
Well, this morning.
on Twitter,
Well, this morning without a G.
on Dailymotion and YouTube.
Well, this morning.
And this fabulous repeat is going to be at
11:05 p.m. in the evening tonight. 11:05 p.m.
Till the next time, 1, 2, 3.
Good morning.
Thank you very much.